Joining me now to discuss this is a public health physician, Jamiu Ganiyu. Thank you so much for joining us on TVC News at 1. What has been your assessment of our COVID-19 response as we now surpass the 10,000 COVID-19 new cases, active cases precisely?
Well, I won't be able to say whether we are actually doing very well. The issue of response has to do with how much effort the government is able to put. But one thing I would say for sure is that we need to learn from what is happening globally now, especially the India experience, of which just within a week, cases rise from number of them rise from 2,000 to 180 something, and a lot of factors have been attributed to that, like laxity in terms of conforming to precautionary measures and so on. I will advise that we need to step up our game, is that we'll be relaxed, and the virus is still behind the corner, still spreading like wildfire in other countries. And Nigeria is not in isolation. People travel from those countries and still come into the country. So we need to actually, start putting other things. Is that we'll be relaxed. We need to wake up. Like as far as what's happening in India right now, it calls for worry. Like they just discovered a new mutant gene. They call it double mutant variant, which is first of its kind, and another variant like the variant from Brazil and UK. And everybody is aware of what is actually happening in India, increase in mortality, increase in mobility. So I think Nigeria will need to step up, trying to ensure that we institute all the possible public health measures in our port of entry. We need to ensure that we introduce restrictions, maybe from countries like travelers coming from India, or anybody that pass through those travel, maybe connecting flight from India to any other part of the country. We need to just step up our game. Apart from that, we also need to ensure we enforce some of these measures. This virus has not left us. It is gradually becoming, we used to call it pandemic. It seems it's gradually becoming an endemic thing that we have to live with it for a very long time. So we need to, ensure that we continue with our sensitization program, letting people know that the virus is still with us. We need to wear our face masks, mention social distancing and hygiene in everywhere people go and in all public places. Actually, we need to reintroduce our protocols. We need to bring back all those things we've left behind, or with a kind of softening our guide about them. We need to bring them on board.
Right, Mr. Ganiyu.
So that, yes.
Allow me to butt in now. Our thoughts are, we see what is happening globally, especially in India, and our thoughts are with our brothers and sisters there. But then we survived the first case, the first wave, and the second wave is something we are in. Now we have experts who are talking about the third wave. Do you think Nigerians, well, you are actually telling us to go back to what we used to do, taking care of ourselves against this COVID-19. But do you think we have really let down our guard?
Yes, because why I'm saying that is that I was going through what happened in India. India is just going through the second wave. We have a similar picture with that of what is happening in India, in the sense that at the time, India was able to control to a certain level. Number of cases came down to about 8,000 plus. At the end of the day, people were no longer conforming with all the non-pharmaceutical measures, and people holding rallies, parties, more testing and so on, increase in mobility from one place to the other. And at the end of the day, the virus gets established again. They are now witnessing a very severe form of the second wave. What I'm saying is that Nigeria is not isolated from every other country. Whatever is happening in other countries also can affect us directly or indirectly. So we need to be very cautious, ensure that we as I've said, our port of entry, we need to really make sure that we put all the measures in place so that we'll not import another variant
of the COVID-19.
Like as I just told you, the new variant is in India. I mentioned the double, that's the first of its kind. They call it the double Why it's so different from other is that it's a kind of double mutation on that virus, which has even evaded all those people that have even been infected before, or those that have been vaccinated before. So what I'm trying to say is that I don't think we need to go to sleep right now because of what is happening in other countries like India.
That's right. That's right. We anticipate better days ahead in our country and especially in the world. Public health physician Jamiu Ganiyu, thank you so much for speaking with us on TVC News.
Thank you very much.